I'm Pam Darnell, President and CEO of Family and Children's Place. While not all children who exhibit these behaviors or traits have been sexually abused, there are some common behavioral indicators. Difficulty concentrating or staying on task, agitation and irritability are common. Lacking motivation and showing little or no emotion may also be signs of sexual abuse. Unexplained episodes of anger, rage, or moodiness may occur. A child who has been sexually abused may make strong efforts to avoid or to be with a specific person without an obvious reason. Behaviors such as not wanting to change clothes in front of others or participate in physical activities may be other indicators of abuse. Being consistently dirty, lacking sufficient clothing, or begging for money or food may also be indicative of sexual abuse. Sudden changes in behavior may occur, such as becoming more withdrawn from normal or routine activities, being more aggressive toward family, friends, pets, or toys, or unexpected changes in school performance. The child may start coming to school or activities early, staying late, or not wanting to go home at all. Sometimes children experiencing sexual abuse assume more of a parental role with younger siblings, often as a protective measure. Play may be absent or may be violent, or the child may engage in persistent play with sexual themes. The child may express feelings of hopelessness, depression, or self-hatred, or may actually harm themselves or attempt suicide. Some children experience nightmares and sleep disturbances and may regress to bedwetting or other behaviors too young for their current developmental level. Older children may develop substance abuse problems, have eating disorders, or run away from home. Another indicator is when a child displays knowledge or interest in sexual acts that are inappropriate to his or her age, excessive masturbation, or even displaying seductive behavior. Physical indicators may include unexplained injuries, pain when toileting, and trouble walking or sitting. Pain, itching, bleeding, or bruising in or around the genitals, a sexually transmitted disease, or pregnancy, especially under the age of 14, are all red flags. Sometimes a parent's demeanor or behavior sends red flags about child abuse. Warning signs include parents or caregivers who do not provide adequate adult supervision or who are emotionally absent. These parents or caregivers often isolate the child from others, including peers. They may show little concern for the child, seem unable to recognize physical or emotional distress in the child, and may offer conflicting or unconvincing explanations for a child's injuries. If staff or teachers see these adult behaviors, they would want to consider if they have observed any of the other indicators already mentioned. If several indicators, along with these parent or caregiver behaviors, have been observed, the staff would want to consider calling Child Protective Services. If a child discloses abuse, it is critical for you to stay calm, listen carefully, and be a source of safety and support. Manage your own emotions and do not overreact or underreact. Be aware of what your tone of voice, body posture, and expressions may be communicating. The child needs you to be the adult, to be in control, and to provide safety. How you respond will influence what the child chooses to tell other people about the situation. Allow the child to share at his or her own pace, using his or her own language. Do not press the child for details. Do not make remarks that question the child's experience or even confirm the experience. Just let the story unfold. Use your own experience to help you understand what the child may be feeling, such as fear, hopelessness, shame, or guilt. It is okay to ask feeling-oriented questions that allow the child to share their experience safely without asking specific questions about details. You may make supportive comments such as, "I'm sorry that happened to you," I understand what you are saying. That must have been difficult for you. I can understand how you might have felt afraid, or confused, or angry. How did you feel? How do you feel now? You sound like you feel angry, sad, confused, or scared. You look angry, sad, or confused. It's okay to feel angry, sad, or confused. Assure the child that their feelings are okay. Most importantly, assure the child this is not their fault. Thank the child for telling you and reassure him or her of your support. Do not promise to keep something just between you and the child. Do not ask for additional details about who, what, when, where, or how. That is the job of the investigators. Do not try to sort out what is true or make discounting statements such as, "Are you sure you did not misunderstand?" or "He or she would not have done that. You are wrong." Or, "That isn't that bad. It could have been worse." Your job is simply to listen to the child. Call in the report immediately. Document your actions and follow the policies and procedures of your organization.
To learn more about how you can be the face that ends child abuse and how you can bring a child abuse prevention training to your organization, visit faceatabuse.org. One case of child abuse or neglect is one too many. Let's join together to ensure that all kids are free from the tragedy of abuse in our community. Let's face it and end it.